Sheffield, we offer a fantastic paediatric service. We've got a great team of staff here. We care for a whole range of specific needs and complex cases here. We work well with consultants and surgeons. As paediatric nurses, we're present right from the offset, so we are with consultants in the outpatients clinics, and then when they're booked onto their surgery, we see them in clinic at pre-assessment. We can get a whole range of information from the parents and families there. We can make them feel at ease before they even come in for their surgery. Once they do come in on that day, that means that they've already met us. So they've got a familiar face there and they're much more comfortable and at ease.
Here in the outpatient department, you can be seen by allergy specialists, dermatologists, orthopaedic surgeons. On the ward, we do day cases, mainly orthopaedics, but we do a lot of scoliosis operations.
We're open from 7 in the morning till 8 in the evening. Most patients will go home like before tea time. We'll let them to get home before the dark in winter.
Children aren't just small adults, so there's a whole load of other factors that are involved in looking after them well. So we have specialist nurses, specialist anaesthetists, we have specialist surgeons, specialist people in critical care to look after the children and to help support their parents through their hospital journey.
When they come into a consultation with us, we have toys available for them to play with. I get crayons and drawing and things out with them to make the environment more familiar to what they're used to at home. And the consultant speaks to the children directly, not just speaking to the parents, and tries to involve them in the consultation.
It's really important for the children and their parents that they feel comfortable with the assessment process, with ourselves as specialists, but also in the environment that they're in. Because if they're confident and comfortable and happy, then it will help them get the best possible outcome.
When a child undergoes an operation, it's a scary time for both the child and the parent. The child might be scared to move. We've got to give them the confidence to move, to get up and walking. And we also explore things such as how they're going to manage returning to school. A lot of children are very keen sports people and want to return back to things such as gymnastics, football or rugby, and we can guide them through their progress back to these goals.
Every parent that comes into hospital at Nuffield in Leeds are given a phone number to ring should they have any problems, and we don't often get phone calls out of hours, but when we do, we manage because we've got an on-site doctor as well who will give advice appropriately.
We give all our children a Nuffield Health goodie bag, and in that it includes the Nuffy teddy bear, which represents the Nuffield Health Hospital. They also get a nice bravery certificate at the end of their stay, so it just gives them a little keepsake forever.
A lot of adults will go away and read about their problem, Google their problem and come to you with a diagnosis, whereas a child comes in and says it hurts here. It's far more helpful to know that. The other unique thing about children is often they perceive things in a very different way. Something that I look at and think, if that was my arm I just wouldn't be bothered about, they might be really bothered about it, and I see that particularly with deformity. And actually when you spend time with children and speak to them about it, sometimes they get picked on at school or bullied because of it, and it's really nice to see a child that comes in with a problem and you've been able to help them, and that moment when you discharge them from clinic and they leave with a smile on their face, it is really rewarding.
I can obviously, from a nurse's point of view, help the consultant by offering advice from a nursing point of view and from being a mum myself.
I love being able to make a difference to those children and making sure that they're comfortable, happy and relaxed when they come in and when they leave as well.